Okay, and now we have Minister of Health, Dr. Frank Anthony. And Minister Anthony, one of the major things that, of course, people are looking forward to this budget as it relates to health is what will be additionally done in the health sector regarding COVID-19. Some over $6 billion, I think, has been allocated to step up government's efforts to reduce the spread of COVID-19. Let's talk a bit about that.
Well, thank you very much for having me on the program. But perhaps before we go to the sector, allow me to congratulate Minister Ashni Singh for a very comprehensive budget. It touched every sector, created measures that really going to help people on that pathway to prosperity. And I want to express my gratitude to him for presenting such a comprehensive budget. And he has laid the foundation for the transformation of all the sectors in Guyana, including the health sector. In terms of the specific question that you spoke about, COVID-19, of course, we know since its appearance in 2019, has created a lot of problems around the world. And right now we have about 5.5 million persons who have died from COVID, with more than 350 million cases. Because of the new contagious variant, we expect that COVID-19 is going to be around for some time, and that is why the government has made this generous allocation of more than $6 billion. This is going to go to help us to maintain our system of hospitals and beds that we have, and of course to buy all the necessary equipment, the PPEs, the supplies that we need, and of course medication. So this, it's going to help us to work with our COVID-19 patients. Of course, as you heard the minister too, part of this allocation is to make sure that we have adequate vaccines, and we have made a provision in this year's budget to purchase vaccines that are going to be for children 5 years and less than 5 years of age.
I know particularly the expansion of healthcare facilities is a big one in the budget, some $16.1 billion. Tell me a bit about what we're expected to see this year with that allocation.
Well, there are a number of new projects that are coming on stream. As you heard, we are doing 6 new regional hospitals. From Skelton, we have that new regional hospital that is going to be going up there. In Region 5, in the Bath area, in regions on the East Coast at Enmore, on the East Bank at Little Diamond, then in the Tushin area in Region 3, and of course in Anna Regina in Esquibo. So this is the first wave, if you like. And then we also have hospitals that we are going to rehabilitate. And when I say rehabilitate, I'm using that in a very loose way, because we are actually going to be building new buildings on an old site, so to speak. So we'll be doing that at West Demerara Hospital and at the Bartica Hospital. A completely new project would be a project that His Excellency would have spoken about, and that is the new Maternal and Child Health Hospital. This is going to be a subspecialty hospital, and we are going to cater for patients with very unique needs. At this hospital, if children need cardiac surgery or they need oncology services, all of that would be provided at this particular facility. So it's going to be highly specialized. And again, while we cater for a local population, some of the newer services that we are developing would look at the broader Caribbean, where people can come to Guyana and get these services as well.
Medical tourism.
Medical tourism.
Thank you so much.
Thank you
so much.